And on this week in pharmacy, there's so much going on as we're concluding, coming to the end of 2024. And what's really helped us as a publication and the evolution of what's happening in pharmacy care, we've had so many organizations part of the content in 2024, and it's helped us set the stage for what I'm calling the year of the pharmacist. The year of the pharmacist in 2025, empowering the pharmacist to do more as a treatment leader and being able to dig down into conditions. We're so proud of our pediatric division and our geriatric division and specialty pharmacy specifically today, because on This Week in Pharmacy, Jennifer Noonan is back. Jennifer Noonan is the VP of Clinical Strategy and Patient Engagement with Accessia Health, which has been an important partner of ours for 2024. Jennifer, I've loved this partnership. I've loved the education that you've brought to our listeners and to our pharmacists to really understand the ecosystem of care includes the payment side of care and how much through getting your claims paid for and getting medications going, solve what happens in the payment world, how dangerous that is to keeping people on their medications and medications adherence. So welcome back to This Week in Pharmacy and welcome back to the show.
Thanks for having me, Todd. Good to be here.
Right out of the gate, we want to know, coming to the end of the year, lots has happened. Accessia has been everywhere. Been very proud of your representation in pharmacy. We loved working with you at NASP, at Accessia. But what's the current state for many patients who you come in contact with? Are their needs currently being met?
Well, I guess it depends on which patients you reference, of course. I think this year's theme has been overarching the changes coming, of course, with the IRA. What kinds of, concerns do we see all of the different stakeholders having? But for us, specifically with offering financial assistance to individuals, is trying to understand what that's going to look like in the coming 2 years, especially with those changes starting to roll out. I will tell you that one question I think I heard the most frequently across all the conferences, both from patients and providers, was from charitable assistance organizations like mine and on a few panels with others as well. The question of whether or not charitable patient assistance organizations would continue to still help people with payments if they were involved in smoothing or if there were, different programs that they had through their insurance. And the answer to that is yes. I haven't heard anyone say that we wouldn't. We're working on all the details of what those processes are going to look like, and we've been working directly with CMS as well to understand how those impacts are going to show up in light of the assistance that we're providing for individuals, and also how that might change the landscape of needs over time.
So I have talked with you so many times about this, and I think it's almost the starter, and that is the awareness of the availability of the program. That starts with the pharmacist and the pharmacy that's helping this individual. You've gotten them started, you got the prescription from the physician, you're starting them on therapy. You don't want these roadblocks keeping them from getting started and staying on. So, what sources are currently available to patients that they may not be aware of?
Yeah, that's a great question. And I know we have talked about this. It feels like several times a year in the last couple years. But for me, working as a nurse in patient-facing environments for over 25 years, I never knew that there was assistance available for individuals. I do know that in specialty pharmacy, that has probably something that comes up a lot more frequently because there is the cost associated with some of those treatments. And of course, pharmacists and pharmacy techs alike trying to find a way to get the patient to their treatment, right? How do they gain access to it? So I think, most important is that everyone be familiar with the different different organizations that are available to help with financial assistance, but also tell people to reach out individually to condition-specific advocacy organizations. So just an example of that as it popped into my head would be a disease like muscular dystrophy or Duchenne muscular dystrophy, to reach out to those organizations directly. If you're struggling to find the answers or solutions for those, and also sometimes they have lots of peer-to-peer support that help patients understand where to go next if they're struggling to get those ends met. But one other thing that we have seen very broadly this past year is a bit of a decrease in some of the costs for out of pocket for medications directly, but the associated premiums for having, say, a Part D plan, or folks who are purchasing, marketplace uh, insurance plans in order to receive a cost-effective treatment, they have to have insurance. And so we've seen the cost of insurance rise over this past year pretty considerably, and we've seen kind of that same trend happening with our peers as well. So I think navigation for appropriate insurance is really important, and that is something that we offer as well, agnostically, just to help people understand what different options are out there and help them make choices that will leave them with, the health literacy about what their costs actually are going to be for the year in order to make decisions about how to get at them.
Yeah, that stress level, the extra level that you've described to me. I'm standing in your booth at, I think it was Assembia, and it was like you're giving, and you weren't talking to me directly, you're talking to someone else, but I was listening to your story about how the stress just adds another layer of not getting that position of healing, meaning I've reached that mental position where I'm still nervous because now I'm dealing with the disease, I'm dealing with my condition and how I'm feeling, and then all of a sudden my family's stressed out because of not being able to get my medications paid for. And it's just a whole nother layer of healthcare, and it's a whole nother layer of empathy and understanding what does that patient actually go through. And Accessia Health has been extremely dialed into exactly that, where as a nurse, and you've seen this from being on the other side, where you were a caretaker and these people were confiding in you what they were going through, and now that comes out into the wisdom that you can kind of preface, hey, we know what it's going to be like going through this. And when you say that to somebody that's going through something and they know that you know what they're going through, that trust is part of the care, because now they're able to make that phone call and say, I'm still not sure about this. Can you re-describe this to me, or what this benefit is? That sets in place for the future of what 2025 is going to bring, and the expansion of Accessia Health, as well as your tie into disease state management specifically. You just mentioned one that's horrible and what they probably go through. So now we're thinking about the future. So I'm thinking, what's coming up in the next year or two that's going to impact patients in those specialty pharmacy spaces. Because I can't wait to see you at Assembia 2025.
Yeah, it's already on the books, isn't it? It's crazy. Um, I'm glad that you mentioned the piece about the layers of burden, because it is something that I do talk about a lot if I have an opportunity to, because it's what I think some would consider a small piece, but it's also probably one of the most impactful for the individual that's going through the situation. So I had worked in hospice care for about 8 years, and one of the things that was at one point beat into me, if you will, as a training, but then also passed along, was being able to recognize that when individuals are receiving hard information or scary information, that they're not able to retain as much. So we tell these folks this terrible news about a new diagnosis, and then we send them on down the road to go try to get this treatment plan started because this devastating illness that they've learned about, and then they have to ask for help with money. And I think that it's important to call out that anyone that's ever had to ask anybody for money, no matter who you are or what you're going through, it's not an easy thing to do. And so just being sensitive about that, I think, is huge. Being able to maybe put practices in place where you start off by letting people know that these are expensive treatments and you recognize that it might be difficult to get those filled so that you're, as you mentioned, starting out with an opportunity for a safe space to ask questions or to be vulnerable and say, yeah, I'm not going to be able to afford this medication. I need help. Most people don't ask, right? And so just making it easier for people to ask for that help, but also it, the piece about understanding where people are, we can't always understand what it must feel like to have a certain type of condition that's just unfathomable. But at the same time, I think just listening and validating when people are telling you, probably for the 50th time, some of their history or what information they need to relay to you in order to get the next step done, is often repetitive. So even saying at the beginning, I realize you probably told this story a million times. I'm so sorry to ask you again, but then you're at least setting up the baseline for saying, I hate to do this to you, but it's an important piece, of this work that we're trying to get accomplished here. And I think it makes people more willing to help and get in there and do their own part too, if they see that we're working alongside them.
So before we started recording, Jennifer and I were sharing about our 2024, and I said how happy I was that even though I love conferences, I was glad to be back in the office for the remainder of the year. You, on the other hand, are being pushed up back into the world, and I know that you love the conferences as well, but it's just part of life and what we do as advocates and communicators of better healthcare. And so you're headed to, I think it's called the American Society of Hematology. And this organization, hematology.org, is a powerful organization in hematology specifically. But Accessia is going because you believe that this is obviously it's an extremely important part. It's probably a condition that doesn't get enough attention. And then the merging of our pharmacists and our physicians and our nurse practitioners and our specialists, it's going to give everybody an opportunity to really converge on the disease state and condition and diseases. So talk to us a little bit about Accessia at this event.
Yes, we're excited to be attending ASH, or the American Society for Hematology. Their focus is going to be surrounding different blood disorders, including blood cancers. But of note for populations of individuals that we serve and have for a very long time is the bleeding community. So hemophilia, sickle cell, ITP, TTP, different types of bleeding and clotting disorders. And so I think oftentimes there's heavy focus in oncology and there's focus in some of the bleeding disorders, but this is kind of an overarching scientific and provider get together that's going to help look at some of the new science coming. You had mentioned earlier about just the burden that goes along with some of these complex health problems. But I think another piece that's starting to emerge is as we're seeing folks get their disease almost halted. I know there's lots of hesitancy around saying the word cure, but individuals who are no longer having to have treatment for a particular condition that they've had their whole life. And one of the things that has come from this is we see people who are struggling with some mental health struggles, depression, because they're having trouble identifying with themselves. They've had support from teams of people, and especially those who've been in trials have had a lot of touch points with all of those different individuals. And then once they're through with that cycle, they're in this place now where they don't really, other than advocacy, which is huge and an important way for some of the folks to fill their time that I've heard about, is they don't feel like they are who they were anymore. So just calling out that these different conditions can also cause mental health problems, and that we need to continue to work on those layers of burden that we can help remove to ease that.
Awesome, Jennifer. I trust you because I've talked to you so many times. It flows through you, just comes through your spirit of helping people. So this is special. Hey, listen, listeners, if you aren't looking, if you're not watching us on YouTube, it's not an issue. If you're driving, you're jogging, you're doing something, you're just listening. But if you are going to this event, I want you to go to accessiahealth.org. Once again, that's accessiahealth.org. Go to the contact section. You can see it up on your screen now if you are looking at us on YouTube. Scroll down when you get there. Fill this out, who you are. Just give us some of your information. And then down at the reason for contact, put in the name of the conference. What's the name? It's ASH, right?
Ash, uh-huh.
ASH 2024, and then write a little note in for Jennifer. Send this to them. They'll get this, and then coordinate a time to meet up with the Accessia team while you're at this event, because this will give you an entire another layer of preparation for 2025 as healthcare providers and understanding the ecosystem and how important payment is for this. It might be something you haven't even thought of, but if you are going to this event, make sure you take time to meet up with Jennifer and the Accessia Health team. Jennifer, I'm proud of this organization. I want to give a shout out to my Finn partners, brothers, and sisters there that have brought me this organization, and how special you guys are, because we've never had a payment program, assistance program as part of our content, especially for those rare diseases in specialty pharmacy. And we're excited about 2025. Definitely want to keep partnering with you and getting this information out. But if you could have kind of a wish for the closing of 2024, in order to make kind of like that next step in being an advocate for the patient, what is that wish for the closing of the year?
I think, Todd, really just to stress the importance of recognizing that we can make differences in what a lot of us feel and look at as a big broken system. You hear that term used very often, but we all are part of that, and sometimes really small measures can make a big difference. And I think the momentum is the most important part. And just let everyone know that we are here. We're here to help serve individuals, and we would love for anybody that has questions to reach out to us, and certainly look at our resources page and sign up for assistance if needed.
Absolutely. Thank you. All right. So good. You were part of This Week in Pharmacy. Definitely want you back, Jennifer, and we'll keep in touch. Looking forward to seeing you at Assembly 2025.
Sounds great. Thanks a lot, Todd.